Hello, Annabeth. I'm student Dr. Smith, here to be doing your exam today. What brings you in?
I have a mole on my right foot.
Oh, I'm sorry. Did you just recently notice this mole?
I've had it for a long time, but it started to grow
Okay, when did you notice it was growing?
about 2 weeks ago.
Okay, 2 weeks ago. Is it painful?
No,
Okay, so there's no anything that aggravates, causes it to be painful, irradiating, nothing pain related?
no,
Okay. In that case, I'm going to ask you about your previous medical history, just getting some background. Have you ever been hospitalized?
no,
Okay. Have you ever had a major illness as an adult or child? No? Okay. I see from your chart you are up to date on your immunizations. Good job. Are you on any medications?
no,
Okay. Are you allergic to anything?
no,
Have you ever received a blood transfusion?
no,
Okay. And the patient is alert oriented? Okay. Are you sexually active?
yes,
Okay. Are you practicing safe sex?
Yep.
Good. How many hours of sleep do you get?
8,
Oh, wow, stellar. Do you smoke?
nope.
Okay. What do you do for work?
I'm a nanny.
Nanny? Oh, I bet that's exhausting.
Yeah,
But good for you.
this is my only day off.
Oh, well, sorry you're here. How would you describe your exercise habits?
Not a lot.
All right. Do you use drugs?
No.
Okay. How would you describe your diet?
Pretty healthy. Trying to be gluten free. Seeing how it's going.
All right. Is that working for you?
Pretty well.
Okay. Do you drink alcohol?
Nope.
All right. Do you have pets?
Yes,
What pets?
I have a dog.
All right. What kind?
A Shih Tzu poodle.
Nice. And are you married?
Yes.
And are you monogamous?
Yes.
All right. Cool. That's good. And have you left the country recently?
No.
All right. Awesome. Well, we're going to move on to the exam portion. So first I'm going to check out your vascular system. So I'm going to start by looking for pulses here. So your dorsalis pedis, 2 out of 4, present bilaterally. And then your posterior tibialis, or posterior tibial artery, 2 out of 4, present. And now I'm going to check behind your knee for your popliteal pulse. 2 out of 4, present. And 2 out of 4, present, both right and left leg. Excellent. We're going to just check your hydration status for your skin. Sugar is good. Bilaterally. And elasticity is good as well. Noticing normal hair growth patterns, which says there's no peripheral vascular disease. And temperature is normal, a little cold, but that might just be the office, huh? And lastly, I'm going to check your capillary refill time for your vascular exam. Okay, no abnormalities noted on the right. And no abnormalities noted on the left. We're going to move on to the during portion of this exam, so I'm just going to start off feeling for any nodules, none on the dorsal or plantar aspect of the leg and foot. Some dry skin on the plantar aspect of the foot. No lesions besides the mole noted, and no ulceration on the right. Okay, no nodules or bumps noted on the left leg. Birthmark noticed on left anterior tibia. And some dry skin callousing on the plantar aspect of the foot. Very normal. Nothing to be worried about. So you can check between your toes. No macerations interdigitally, and the nail beds look healthy. And that is true bilaterally, both right and left. Okay. We're going to move on to your musculoskeletal portion. So what I'm going to do is I'm going to push down, and you push up against. Okay, so wire push, you resist. So, okay, dorsiflexion good, everters are good, inverters good. Ooh, very strong. Good job. Good job. All right, so I'm going to evaluate your range of motion and your joints. So you just let me know if anything's uncomfortable or painful. Okay, so first ray on the right. Limited range of motion.
What's the pressure there?
That's painful. Might have a little bit of supinatus there. So I'm going to check your tarsal joint range of motion. That seems fine. And then your subtalar joint range of motion.
I really don't like that.
Yeah, is that painful?
A little.
Okay. And limited subtalar joint range of motion. So I'm going to check your dorsiflexion. So I'd say limited dorsiflexion. Now I'll lift your knee up a little bit. And markedly improved dorsiflexion with the knee flex. So looks like you have some tight gastrocs. Okay, so we're going to do the same on your left foot now. Starting with the first ray. Markedly better range of motion on the first ray on your left foot.
I have a short leg. I don't know if that changes anything.
I'd say that's probably true. This is the longer leg. Yeah. Okay, better MTJ range of motion here. Still limited subtalar joint range of motion, but less stiff, and this isn't painful. Okay. And let me check your. That's all.
I could do that.
Oh, okay, well, just relax. Okay, so still limited range of motion. And then we're going to try it with the V flexed. Okay, so a little bit improved. So you have some tight gastrocs. Just, stretch against the wall. That doesn't really improve anything. Come back to see me. You can maybe take some further steps. Maybe get you into some orthotics that might help you. Okay, so we're going to move on to our neurological portion of the exam. So we're going to start off with testing proprioception, which is, so you just close your eyes for this, and you tell me if your toe is pointing up or down.
Down. Up. Down. Up.
Okay, good. On your right.
Up. Down. Up.
Okay, left foot passes as well. We're going to do on a filament test. This is this light little thing. Shouldn't really be painful at all. And you just tell me if you can feel it or not. So you can close your eyes.
Yes. 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 Yes.
Okay, 10 out of 10 on the right foot.
Yes. 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 Yes.
Okay, 10 out of 10 on your left foot. Good. So we're going to do a sharp dull test. It's not really sharp, so don't worry. It's, and then this is dull, so sharp, dull. Okay, so don't look. Tell me sharp or dull.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, excellent. Passes the sharp and dull test. So we're going to check the vibration sense. So this thing vibrates. I'm just going to put it on the prominence. You tell me when you feel it.
Yes.
Okay, tell me when you feel it stop.
Stop.
Okay, good.
Start. Stop.
Excellent. So I'm going to next check your Babinski's reflex. So I'm just going to come up. Might be a little bit weird and uncomfortable. Okay, so that's negative on the right. Negative Babinski's on the left. Perfect. So I'm going to have you scoot forward. Okay, good. Patellar reflex intact. Okay, fluid's intact. Okay, a little bit of movement there. Okay, and Achilles intact both bilaterally. Okay, I'm gonna have you scoot back again and up. So let's look at this a little bit more. Yeah, there is some sort of you have some unclear borders here, discoloration. So this could potentially be a number of things. It could just be one, a normal mole or nevus. It could be a blue nevus, which explains maybe it's a little darker look. The other thing it could potentially be is a nevus that is becoming dysplastic, moving towards something like melanoma. Or it could potentially be another sort of skin lesion like basal cell. So I'm going to take a punch biopsy of this today. Just get it on the area, take it out, and we're going to stitch it up, bandage it. We're going to come back in a week when I have the results. We're going to go over them together. I don't want you to worry too much, because this is most likely, just a mole. But I'm glad you came in today so we get this evaluated, because it could very easily turn into something. So I'm also going to teach you how to do self-checks so you can distinguish for yourself if you need to come in and have another biopsy. And are you using sunscreen when you go outside?
Mm-hmm.
All right, keep using at least SPF 15. The higher you can go, 50. SPF 50 is the best, but if you're going to be on the beach or something like that. So, okay, well, let's get that taken care of for you. Thank you for coming in.